Okay, so this one is called noise test, N-O-Y-E-S. Again, anterior lateral rotary instability. The reason why we like the anterior lateral rotary instability is because that's the most frequent one. With this one, the knee starts off at 15 degrees. And this one, you're kind of off to the side, so we'll do this. Knee flexes 20-30 degrees, and then the knee subluxes. Okay, so what will happen is, some authors suggest that you can even put an anterior drawer at the same time. Okay, so in this slightly flexed position, give it a little bit of an anterior drawer, but as you flex, the person is subluxed. So at 20 to 30 degrees, the knee is technically subluxed. Okay. In this position, in the subluxed position, if you push the knee back down, it'll reduce. So one of the things that you'll see in this reduction is the femur will internally rotate. So you may or may not get a clunk. A lot of times you don't get a clunk with this. All you're looking for is to look at the femur and watch it internally rotate. Okay. Now in that position, if it doesn't internally rotate, which it should, if it doesn't internally rotate, then that means it was never in a subluxed position to begin with. It was stable the whole time. Okay, if there's no excessive movement in the femur, when you go from flexion and anterior drawer to posterior drawer, if nothing happens, that means everything's fine. Okay? So all it is anterior drawer with a little bit of flexion, and all you do is just pushing down. Just do a posterior drawer.
But when you're pushing down, you're not extending again, you're just pushing down?
You're just pushing, you're keeping it in that same position. Because according to McGee, at 30 degrees of flexion, it's already been subluxed.
Oh.
Okay. And if it's subluxed, then the femur will just fall external rotation. Okay. If you push it back in, it'll pull it back into internal. Okay, so that's what we're looking for. I'm assuming everybody has an ACL, so you probably won't be able to see this. Okay. So think about it this way. Instead of doing an anterior drawer with the foot on the table, you're just picking up the leg, bending it at 30, or keeping an extension, bend a little bit, and then posterior drawer. So this isn't really a combined movement like those other two. Any questions about noise? Okay, so try that one, and then we'll get into the collateral ligaments and the McMurray's meniscus. Okay, so actually, how about do this? Try this one, and then take a 5-minute break. And then during the break, if you want to stay and practice some other stuff, by all means.
Oh, man, I've done it so much. That was so seductive.
With the noise test, you're just observing what the femur does.
Observe my femur. I mean, like, I have 8 hours.
Well, that's it. But you're not there. Or if there's nothing there, you do that.
I won't.
It'll reduce, and the reduction is but you're observing. Again, you're observing the femur when you apply the posterior drawer. That's all you're doing as a therapist.
Do it anterior.
So stop the head of your foot. Because your foot and then push down. And like kind of
Again, grab somebody else's knee. If you're comfortable with this,
like, can I help?
we've done about 6 or 7 tests. Go through all of them. Go through all of them on as many different knees as you can. The knee and the shoulder are the most complex. Now's a good time to practice. 7 minutes before we start up again. So practice and or take a break.